That's your before, that's your after. The structure of your face is going to change. Not just here, but your eyes will look different here. Your eyebrows will look different. Everything is going to change. So you have to realize that this is what is going to settle in.
Hi fellow YouTubers, this is Amber. If you guys do not know who I am, I'm a plus size model, YouTuber, and entrepreneur. Welcome to my channel. But today I am going to be talking about rhinoplasty and my consultation with Dr. Rawnsley. Stay tuned. So first, you guys know me from putting the nose inserts in and also doing the nose threads. So you guys seen those two videos that went pretty big on my channel as well. The nose threads were really huge on my channel, 81K. Thank you guys so much for watching and commenting on that video. It's very much appreciated, and I'm glad I got to spread the word out to other people who may want to do it because it's a temporary process. However, I didn't know if I wanted to keep doing that process every single 9 months to a year. I felt like it was a little bit strenuous on me, a little bit, and I don't know if I wanted to continue to do that every single time. But I was thinking about doing it at least 2 or 3 other times. So I looked into rhinoplasty, but I actually looked into rhinoplasty before I even knew about threads. I did not know about threads whatsoever. So I went ahead and looked up rhinoplasty, and I found a doctor that does African American noses and ethnic noses. So I seen him because I was just looking up rhinoplasty, looking for a doctor that can do it, that was possibly black or knows how to do a black rhinoplasty. His name popped up because I seen 2 pictures and of this girl here, and I thought her nose job was so good and so flawless, and I was like, wow, this is something I really want. So I wanted to make a consultation with him. Of course, he wasn't free. It wasn't a free consultation. I think it was like $100 to $200 to get a consultation with him. And this is where you guys see me going to my consultation right now and checking it out.
Okay, and 2 more shots.
Okay.
Down to the ground. Chin down. Down, lower. Down to the ground. There you go. Lower. And then up to the sky.
You know, the lady that you did, that's all over YouTube, she's like light skinned. We have like similar noses, and hers came out really good.
Oh, good.
I'm talking about Andrea or Taylor?
She's light skinned, and she's on one of your videos.
Oh, okay.
Andrea.
It's like a year update for her nose,
Oh, really?
and it says she's had it for a year.
Is it on my website or was it on my website?
Yeah, it's on your website and it's on your YouTube.
Yeah, it's Andrea.
Okay.
I think we have kind of similar noses,
Okay.
and hers came out really nice.
Good. Well, that's what people want to see. They want to see that, you know, someone looks like them. That it's a great result.
Yeah.
You know, it's like, so I'm just going to look through these here. First of all, you have nice proportionality to the face. You have great eyes. You tend to be sort of lower face dominant. So we're sort of looking at the projection of the different features of the nose, of the face. So forehead here, nose here, chin here. So you're out, you know, about 15 millimeters or so from the forehead. The quarter view, yeah, you have this little bit of outpouching here of
Like a
flat
hump.
nose. Yeah, it's a little hump. It's a little width here too. You look at the side view, you can see it's not so much a hump. There's a little curvature to it, but it's really more the bone you're seeing kind of come out this direction here. That's the end of the bone right there, nasal bone, and this cartilage below it. From the other direction, you just get less. So it seems like it's a little deviation. From this side, again, more of a curvature. So when I see this, this line kind of goes like this, a little bit curves, a little bit down like that. So it makes it look like the nose is kind of headed downward, although it really isn't, because this is the angle between the direction of the base of the nose and vertical here. So that's a normal 95 degrees or so. So that's fine. From above, the pictures you showed me with that device you're using, this is a little bit wider. It doesn't have the sort of linear look that those guys were giving you. And that might have been.
Do you guys do jaw injections?
For fillers or what?
Yeah.
I have done them. If people are really interested in that, what I usually do is I do implants because they're permanent. I don't think you want to augment your jaw at all. The way your jaw is positioned and all that.
Because it's getting soft. Like.
Do you have fillers in there?
No.
Anything? Yeah. So you're talking about putting it over here,
Like
laterally,
to make it like more like a even. Like it's too oval. Like my face is too oval. I'm trying to give it shape, and then
well,
it's
you can do
soft.
lateral angular implants over here, and that gives more angularity to the jawline itself.
Like this.
That's very common for Asian patients when you do that, but usually chin implants are really central and right here, and they usually to either widen the chin, which I don't need, or to increase projection, which I don't need either. But this you can't do, and it's done through the mouth, you know.
Do you have to go to sleep for that?
So this is kind of just giving you more of a straight shape to the nose.
It looks good.
So I don't know how you feel about the nostril size or whatever. I don't think it's, I think because of the sort of stature of your face, I don't think
To
you
move
need to do
them.
much. You don't want to do much. You're not really moving your knees. They're making you look a little bit smaller.
Like in like that?
Yeah.
I think they look weird on my face because my face is so like big.
Yeah, I think that's true.
Instead
Not
of
weird, but I think it would risk looking a little bit, not as
Too.
proportional.
right. Because my lips are big and my face is kind of big, and then you have these small nostrils on a big face.
So again, this is just giving you a little bit more of a clean line.
Yeah, it looks way better. The tip, I think that once the tip goes up, it will be way more better.
So let me show you what the tip up looks like.
And my nostrils are uneven. Have you noticed that? They're uneven. One side is bigger than the other.
You know, they're within the normal limit of the symmetry, and they look roughly the same. And I wouldn't say they would describe them as a little bit bigger than one.
Like when I look down, the down picture like this, you'll see like one of the sides is bigger. It like I think where's my old nose
So
ring?
we have that picture. Let's see.
I think the old nose ring used to go right here, and I think oh yeah, where the nose ring is at, you see how that side is heavier?
Yeah.
It looks weird.
I don't think even with surgery you can make it look much more symmetrical.
So all this part will be gone because the bone will be gone. This bone will be gone.
No, we didn't fracture the bone, we moved it inward.
Oh, okay.
Surgery for me takes about 3 hours.
3 hours?
Everything's done at UCLA Outpatient Surgery Center.
Okay.
And afterwards, Casaminos just be the tape of plastic that stays off for a week.
So I'll give you a quote, but I already revealed the quote anyway. So this is his surgeon fee, and then these fees go directly to UCLA. Okay, these fees we can't control. This fee we can't control. We'll take 5% off if you pay in cash or check. Okay, now we know everybody doesn't have a money tree, so right now Care Credit is doing 6 months, 12 months, 24 months, no interest. So consider it like, I don't know, like a car note. So you could do 6 months, 12 months, 24 months, no interest. I would do the 24 months, which is the longest one. And then you can always start doubling up like around Christmas time, tax season, whenever. Best way, that's the best way to go. And the way to set it up is if you want to book, you would pay the deposit. The deposit is $2,500. The $2,500 secures the date for you. Nothing else is due until 2 weeks prior to the procedure. Okay. Now these numbers, these two here, these go directly to UCLA, but UCLA doesn't take care credit. So this is going to have to go on a credit card. We're the only people that take care credit.
Right.
So that's the financing part. So that's what you would be looking at.
Okay.
Okay. Now, I'm going to be very transparent, and I say this to everybody. If it's not in the budget, and this is not just to you, but if it's not in the budget, don't do it right now. Wait for it, because I've seen so many people try to struggle to pay for the surgery, and then they work 2 and 3 jobs. That affects your healing process, because your body is healing from the inside out. If you're not getting enough sleep, if you're not eating, if you're stressed out, it's not worth it.
Right.
So just take the time out, save up the money, do whatever you need to do. Then also too, don't cut corners. I've seen a lot of people go to different places, and we've been doing a lot of revisions from Tijuana, Dubai, and Turkey. So that's another thing. Even if you decide if our doctor is not the right doctor, just make sure with making your decision, make sure the doctor is a ENT. Just in case if you do have breathing issues, because I don't know if he talked to you about any breathing issues or anything like that. Make sure they're ENT, and then also make sure neck up. Make sure the plastic surgeon is a neck up. Not saying if the doctor specializes in boobs or Brazilian butt lift that they can't do a nose, but you want to make sure that they focus on this up.
Right.
So this is what I was saying. This was another patient that I was telling you about.
What does her afters look like?
This is her after.
Yeah, it's very subtle.
Yeah.
Very subtle.
So that's what I was thinking.
I want subtle, but a little bit more than just subtle.
Yours is subtle to me.
I want a little bit more than that.
What do you mean? Yours is subtle.
Like, so that's my before, right?
Yeah, this is your... That's your before, that's your after. That's your before, that's your after.
This would be my before.
This is your before, this is your after. So you're taking in here and here. It looks like it's a little subtle here and here.
Yeah, I just want the nostrils just a little bit to come in slightly.
So you need to tell him that you want to do a little update on that.
He said that he didn't want to do the different placement for my nose, but I just feel like this one is so much bigger. But he said that he couldn't do anything about when it's like a little uneven right here. So I just... Did you see Andrea's nose? I
did.
Okay, that's what I want.
Will it fit your face though?
Can they do it in a bigger version? No.
We can do I can see if you could do another updated picture, and then you could see, and we can go off of to both of the pictures.
Yeah.
Okay. So this is coming down a little bit, and then this is pulling it in a little bit. So right here.
Yeah.
So it's coming in and pulling it tight. The structure of your face is going to change. Not just here, but your eyes will look different here. Your eyebrows will look different. Everything is going to change. So you have to realize that this is what is going to settle in. So
yeah,
just be prepared for that. This one is a different change. This one is... I'm just saying.
This is the one. This is a new one that he just did. You think that's too much? Possibly?
No, I don't think it's too much. But I think this is a way different change though.
What do you guys think? Do you guys like
this? This is noticeable. This is more noticeable than the last one.
Yeah. I like this nose a little bit better because it's just smaller, and that will be my before. This is my before right here, and this will be my after. This ran me about $15K if I do decide to get it done, and then if I wanted to get this rhinoplasty done, it would be at the USC Medical University, which is a really top tier university. So I felt like in better hands if I did get it done, because it is USC, and I see a lot of great comments about this doctor, you know, Dr. Rawnsley. And if you look at a lot of his rhinoplasty, I am pleased with all of their rhinoplasty. I don't know how they feel about their nose, but I felt like it's a good natural look. And that's what I wanted. I wanted rhinoplasty that looked natural to being a black woman and not just a European nose. I'm not trying to get a European nose. I'm just trying to correct certain parts of my nose that I don't particularly like, or that can be better. For instance, my width of my nose is pretty wide. It's kind of from here to there. And so this width, I contour a lot so you guys can't see the width of it. But right here, I wanted to bring it in just a little bit and then have a better tip, like, you know, a more swooped in tip. You guys know I have threads, so you guys probably can't see the full look of how my nose would look. It's kind of, it's not super soft, but it's soft enough for me to notice it in pictures. And as a model, you want to look your best, and you are pretty much competing with other models, even though it's said that that's not what we're doing, but that's really what it is. You're kind of competing your looks against somebody else to get that job. So especially talent as well. Talent plays a big role, but also talent and looks plays both roles. So you want to look as best as possible. And I honestly wanted to do rhinoplasty for a very long time. Since I was young, since I was a teenager, I always wanted to change my nose. As a plus size girl and a big girl, I'm 5'8". So I'm a 5'8", I'm a 200-pounder. And I wear size 16, so it's easy for features to be seen as masculine, or features to be seen as like you're already a big girl and then you have a wide nose. So it's easy to be labeled like that, and I don't like that. So I definitely wanted to be more feminine for my face. And I don't want a white nose. I want my nose, but better, pretty much. Okay, so July was very helpful, and they showed me a lot of different things that I couldn't record a lot of stuff in there because of, you know, the rules of the place and the policies that are in place. But I just wanted to like really check this place out, and it's very, very clean. The doctor is very informative, and he got to go over the pictures of what I wanted to make my nose look like. However, at the end of this consultation, I was still a little bit iffy because I'm like, am I going to miss my old nose? Am I going to look so different that I'm not myself? Because I don't want to look extremely different. I just want to correct certain things I don't like about my nose, which is just those two things. I don't want my whole nose to be so different that I can't even recognize myself. So they told me to take some time to really see if this is what I wanted to do. And that's kind of what I'm doing. I still don't know if I want to do it, but there's times where I look at my nose and I'm like, I could do it and it would make my appearance look so much better. And yes, it might be all for the sake of vanity, but it's also for the sake of my career, for vanity, I guess. And just I'm just like one of those type of people. I'm more like a self-obsessed person more than a self-hating person. I look at things to see how I can make things better. So with this consultation, I learned a lot about, you know, the recovery and all that kind of stuff, and staying close to the hospital once you get it done. They didn't tell me that, but another person who got rhinoplasty did. So yeah, I feel like it's gonna be, I don't know if I'm gonna get it done, but I would feel very comfortable with him because he was very straight up with me about things he could and couldn't do. He said he did not want to like make my nostrils come in closer, which I do not want that look. I don't want the Michael Jackson look. He was gonna keep my nostrils where it was, and this side of my nostrils is a little bit bigger. So this side goes down a little bit more and this side goes up. Only I can really notice that, but I look at myself very closely and I critique myself a lot as a model because I want to be on my, you know, my up and up, you know. So I seen that for myself, and he said that he can kind of correct it. He was just really, really honest with me about what he could do and what he couldn't do. 15K is a lot of money versus getting nose threads for $1,200 every single year. It's still, you would still kind of beat out having rhinoplasty for 15K. So I mean, at the end of the day, it's up to me what I want to do. And thank you guys all so much for watching. Make sure you comment, rate, and subscribe, and don't forget to hit that notification bell. Mwah!